Occasionally, some people is having some problems like burning sensation in the chest or heartburn, which can due to indigestion or which can due to some other gastric problem like GERD. GERD is gastroesophageal reflux disease, isn't it? So GERD. So in this condition, what's happening is that gastric acid flows back to the esophagus, so and irritates the lining of the esophagus. So gastric acid flows back to the esophagus and irritate the esophageal lining. So in order to avoid all these symptoms, in order to avoid this GERD or indigestion, we can include some lifestyle changes which can modify or which can reduce our problems. And the first and foremost thing is that if you are a smoker, if you are having the habit of smoking, quit smoking. Okay. Second thing is that low fat diet. So low fat diet means it can be anything. Whatever meal you are having, it should be of low fat. It can be milk, cheese, yogurt. It can be anything. Whatever you eat should be of low fat, because low fat diet minimizes the acid reflexes. If you are having this heavy meals, or if you are having a high fat meal, what happens is it takes time for stomach emptying, and ultimately more acid is produced there. We have to avoid the triggering foods that aggravate the symptoms like peppermint, caffeine, alcohol, spicy foods, fatty foods, garlic, onions, chocolates. All these things can aggravate the symptoms. Okay. And another one is that the other things which triggers is also citrus fruit juices, orange juice, tomato juice. You can always avoid all these things. Okay. Instead of that, you can have mineral water. And for if you are practicing fried foods, instead of frying, you can bake or roast the food. And avoid alcohol, coffee, fried items, spicy foods and all in the evening or during the night, because it can increase the acid reflux. So avoid, especially alcohol. I told quit smoking. If you are in the practice of drinking alcohol, quit that also. That will be better for your condition. Okay. Next is that eat small frequent meals. So if you are having a meal, it should be of small amount and you can eat frequently. It's not that at that time you can have a heavy meal. Okay, there is no need of that. You can eat small frequent meals, which is best for this condition. Okay. Then next is that always make sure that you should not lie down at least 2 hours after eating. You should not lie down immediately after eating. Make sure that minimum 2 hours gap is there before lying down. Okay. And whenever you are lying down, sleep or lie down on left side, because while lying down on the left side, what's happening is that our stomach and the gastric juice, it will be below the esophagus, so that gastric reflex or return of flow of gastric acid from the stomach to the esophagus is restricted there. So make sure that you lie down or sleep on the left side if you are having any condition like this. Okay. Then next is wearing loose fitting clothes. So some people will wear, or some people will wear tight belt, tight clothing, which can increase the abdominal pressure, stomach pressure in the stomach. Okay. So which can aggravate the acid reflux. So avoid tight fitting clothes, especially while sleeping. You have to wear loose clothes. Okay. Next is elevating the head of the bed with extra pillows or beds, whatever it is. You have to elevate the head of the bed while sleeping, which will help you to reduce the symptoms. Next is losing weight if you are overweight or obese. If you are this is one of an important factor. This overweighting or obesity is which can be an independent problem, which can aggravate the symptoms. So if you are obese or overweight, try to reduce the weight. Okay. Then talking to your doctor about your medicine, what all medicines you are taking, because sometimes what happens is that if you are having any medicines, this heartburn or burning sensation just can occur due to the side effects of that particular medicine. So consult a doctor if it is because of that. Okay. Then say no to bubbles. So bubble producing food like soda, beer, all these stuffs we can avoid. Bubbles or to bubbles. So you know that force carbonated beer and all is available nowadays. So beer, soda, all these carbonated things you have to avoid, because it can aggravate the acid reflux. Then cut the fat, or I already told, low fat diet which minimizes the acid reflux. Then caffeine alert, coffee. So if you are so into like I have to drink coffee, you make alternative measures like drink green tea with honey. Okay. So if at all if you are drinking coffee, make sure that it's of small amount and a small glass. It should not be a coffee mug filled with coffee and all. No. Avoid coffee. Instead you use what? Green tea with honey. Okay, that's a very good measure. Next is slim down. I already told weight loss is an independent factor for more frequent and more severe reflux. So always make sure that I think that is the first thing you have to do. If you are an obese person, make sure that your weight should be reduced. You have to slim down, because this factor itself can increase the acid reflux. For that you can do exercises, right? A simple walk is very much beneficial for this condition. Then next is maintain healthy, well-balanced diet. I told before itself some of the aggravating or triggering factors of food items. You can avoid all these things, and you can modify. Fried items can be roasted or baked, or some coffee can be into green tea with honey or something. So some alternatives you have to do instead of using this aggravating or triggering foods. Okay. Next is you have to take right medicines. So what all medicines the doctor is prescribing for you for this condition can be that you have to take it properly. Okay, take the right medicines. And another thing, very important thing I forgot to tell you is that whenever you eat slowly, you chew the food slowly. So this well chewed slow eating habit is a very good thing in order to avoid the acid reflux. So chew properly and eat slowly. Okay. Then next is, then you can record the food diary. So if you are maintaining a food diary, you can track the food which is not suiting for you. So for example, in the food diary, morning breakfast, what all things you had. So you write it on the diary. Okay. So there is no symptom. So that food is good for you. Again for lunch, if you are eating something, you note it on the diary. So then that time if you are feeling burning sensation, chest or heartburn, then you know that something which I had in the lunch is not suiting for me. So if you track the food which you are eating, you will come to know that which food is not good for you for this particular condition. So tracking with the help of a food diary is very good. Okay. So another factor is to increase the acid reflux is that stress. So if you are very much stressed, then it's naturally acidity also will increase. So you can avoid by doing some certain regular exercises or deep breathing exercises, meditation, yoga, whatever is good for you, you can do in order to alleviate the stress factors. Okay, in order to ventilate the stress factors. Next is eating 2 to 3 hours before going to bed. should not eat. If you are eating at 10 o'clock and you are going to sleep at 11 o'clock, that's not good. Eat the food 2 to 3 hours before going to sleep. Next is, so I already told sleep on the left side because stomach and the gastric juice, it will be lower than the esophagus, so the acid going back to the esophagus is restricted there. So if the person is having this condition, try to sleep on the left side. If suppose the person is lying down on the left side, so this is the esophagus and this is the stomach. Okay. So what happens is that the stomach and its gastric juice is lower than the esophagus. So the return of gastric acid to the esophagus is reduced here. Okay. So GERD, what is happening is that the gastric acid flows back to the esophagus. Right. So when the person is lying down in the left side, the stomach and the gastric acid is lower than the esophagus, and the return of this gastric acid to the esophagus is reduced. Is it clear for you? Okay, so these are some of the factors or lifestyle modifications you can do in order to avoid this indigestion or GERD symptoms. So I'll repeat: avoid smoking, avoid alcohol. This too is very, very important, especially alcohol, coffee and all in the evening times or during the night times. Okay. Avoid foods that triggers like peppermint, coffee, spicy foods, fatty foods, chocolates, garlic foods, onions food, all these things, and orange juice, tomato juice, and citrus fruit juices. All this can trigger your condition. Then drink plenty of water in between. It should not be immediately after food. Can have in between the meals, like food. After some time you can have water properly. Okay, but drink plenty of water. That's very good. Next is, if you are overweight, avoid obesity. You have to slim down because that is one of the main and independent factor for acid reflux. One of the main independent factor. And do not eat anything, or immediately after eating you don't lie down. Minimum 2 hours you should give for lying down. Immediately after eating you should not sleep. Give minimum 2 hours. Then another thing is that 2 to 3 hours before sleep you have to eat your food. Then exercises, I already told. If you are having stress, you can have any stress reducing alternative methods like doing regular exercises. Then yoga, meditation, all these things. Then next is sleep. Try to sleep on the left side if the person is having this problem of GERD. So I hope you all understood. Next we'll continue with this topic only. Okay.